all are doing superb. I know you all are doing superb, okay? Just have the faith. And I think all of you know that faith is the light. Correct? Faith is the light at end of the tunnel. And even when you want the tunnel to end, the light's brightness reminds you that it's only the beginning. And have faith. Okay? And it is just a beginning, a bright one too. Correct? And your future is just waiting for you. Just don't worry. Okay? Chalo, we already have finished with the arterial supply. Now we are moving towards the venous supply of the head and neck. Okay. Okay. Chalo, let's start with the structure of vein first. Okay, I know this is very simple, but we should know something about the physiology too. Correct? So, structure of the vein means veins are thin-walled. Okay, thin-walled. Then the arteries, and they are having large lumen. Walls are there, maintain the unidirectional blood flow. These also we know. And then there are three concentric layers that are known as tunicae. Tunica intima, tunica media, and tunica adventitia. Correct? So basically, tunica intima. This is the innermost layer. Okay, endothelial cells and the internal elastic lamina. Then you have something tunica media. This is the middle layer. It contains the muscle tissue, elastic fibers, collagen, external elastic lamina. And then the last one is the tunica adventitia. This is the outer coat, okay, the elastic and the collagen tissue muscle fibers. And then something about the role of the veins, that all we know, that return of the deoxygenated blood to the heart, cushion associated arteries from the jaw movement, that is the periarterial plexus. And basically veins, they protect against the extensive intracranial pressure. Correct? We know this. Okay, chalo. Next, we have something about the classification of vein. This is very simple, very classified basically. Veins, we have two things, extracranial veins and the intracranial venous sinuses. In extracranial veins, we have veins of the head and face and veins of the neck. Correct? And then in the intracranial venous sinuses, this we will deal later, means today only, don't worry. Okay, so first we should know something about the extracranial veins. So veins of the head and neck, head and face, basically we have facial vein, retromandibular vein, that is the posterior facial vein basically, and occipital vein. And in veins of the neck, we have internal jugular vein. Sorry for this. This is coming in between and I think you can't see, but it's okay. I will explain. Internal jugular vein, external jugular vein, vertebral vein and the subclavian vein in the veins of the neck. Okay. So, and intracranial venous sinuses, we have paired and unpaired. I have here written only the paired one because I want you to emphasize, to stress on the paired ones. Learn one and the second will be automatically learned. That's what I tell you always. Correct. So paired one, just learn with me. You have cavernous sinus. Okay, first one. You have superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, petrosquamous sinus, and middle meningeal sinus. Okay, this is the middle meningeal sinus. Again repeat, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus. First learn these. Cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, petrosquamous sinus, and middle meningeal vein or the sinus. Done? Just learn the paired one and just write down the unpaired ones. Superior sagittal sinus. Remember, superior petrosal sinus is the paired one. Okay, superior petrosal sinus, this is the paired one. And unpaired, you have superior sagittal sinus. Inferior sagittal sinus, unpaired ones. Superior sagittal sinus, inferior sagittal sinus, straight sinus, very important. Occipital sinus, posterior intercavernous sinus, anterior intercavernous sinus, and basilar plexus of the veins. These are the unpaired ones. Okay, just repeat once more and then done. Paired ones, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal sinus, petrosquamous sinus, and middle meningeal veins or the sinus. Done? Okay, chalo, we will start with the internal jugular vein first. Okay. Basically, what we should know, it is a continuation of the sigmoid sinus. Very, very, very important. Okay, it is a continuation of the sigmoid sinus. And yes, on the left side, thoracic duct. These 3 points, oh sorry, 4 points you should know. First is the left side, second point thoracic duct, third point internal jugular vein, and the fourth point one is the subclavian vein. Now let me explain. On the left side, the thoracic duct drains into the angle of union of where? Internal jugular vein with the subclavian vein. Thoracic duct drains into the angle of internal jugular vein with the subclavian vein. Okay, and yes, internal jugular vein again repeats everything, continuation of the sigmoid sinus, and we know on the left side thoracic duct drains into the angle of the union of the internal jugular vein with the subclavian vein. Okay, and yes, very, very important. I think last time in the NEET also they gave this question. Behind sternal end of the clavicle, okay, behind sternal end of the clavicle, internal jugular vein plus subclavian vein gives you the brachiocephalic vein. IJV plus subclavian vein gives you brachiocephalic vein. Okay, just learn this. This is very, very important. The formation of the brachiocephalic vein. Brachiocephalic vein is formed by, yeah, internal jugular vein plus subclavian vein. That gives the brachiocephalic vein. And then, yeah, something very important. You have bulbs. Okay, the superior bulb and the inferior bulb. Okay, before that, you should know that two brachiocephalic veins, they unite to form superior vena cava. Okay, superior vena cava. Once again. Okay, chalo. Internal jugular vein, continuation of the sigmoid sinus. Now we know. On the left side, thoracic duct drains into the angle of the union of the internal jugular vein plus subclavian vein. And behind the sternal end of the clavicle, we have internal jugular vein. Internal jugular vein joins the subclavian vein to form brachiocephalic vein. Okay, behind the medial end of the clavicle. And now, next two brachiocephalic veins unite to form superior vena cava. Okay, two brachiocephalic veins unite to form superior vena cava. Okay, and next is about the bulbs of the vein. You have two bulbs, superior bulb and the inferior bulb. Just know something about the bulbs. Okay, these are located in superior bulb located in the jugular fossa on the inferior surface of the temporal bone, just beneath the floor of the middle ear cavity. Okay, once more, superior bulb located in the jugular fossa on the inferior surface of temporal bone beneath the floor of the middle ear cavity. Okay, this is about the superior bulb. Next, you have inferior bulb. It is located at the termination of the vein. Okay, it is located at the termination of the vein, lies beneath the lesser supraclavicular fossa. Okay, yeah, here you can see internal jugular vein, IJV, correct, and see brachiocephalic vein. Okay, okay. So next we have something about the tributaries of the internal jugular vein. I've given the mnemonic also, password here, that medical schools let confident people in. Very simple. Medical school, even dental school too. Okay, but because D is not there, so I had to put M. Correct. Medical schools. So basically, medical schools let confident people in. Confident means we are overconfident, not overconfident. We are confident. Okay, just chuck that overconfident. We are confident. Okay, so medical schools let confident people in. Tributary is very, very important. They can ask you. Okay, I think last time, yeah, middle thyroid vein was the question or something like that only. Okay, so medical means middle thyroid vein, school means superior thyroid vein, let means L4 lingual, C confident, C4 common facial vein, P4 pharyngeal vein, and in I for inferior petrosal sinus. Inferior petrosal sinus. Repeat. Medical school let confident people in. M for middle thyroid, S for superior thyroid, let for lingual, L for lingual, confident, C for common facial, P for people, and for P for pharyngeal, and N for inferior petrosal sinus. tributaries of the internal jugular vein. Done? Okay, once more we will do. Okay. Yeah, IGV, it is a continuation of sigmoid sinus. On the left side, thoracic duct drains into the angle of the union of internal jugular vein with the subclavian vein. Next, behind the sternal end of the clavicle, internal jugular vein plus subclavian vein gives you brachiocephalic vein, and two brachiocephalic veins unite to form superior vena cava. Done. Then you have bulbs of the vein, superior bulb and the inferior bulb. Superior bulb, it is located in the jugular fossa on the inferior surface of the temporal bone just beneath the floor of the middle ear cavity. Then you have inferior bulb, it is located at the termination of the vein and lies beneath the lesser supraclavicular fossa. And then you have something about the tributaries of the internal jugular vein. Medical school let confident people in: middle thyroid, superior thyroid, lingual, common facial, pharyngeal, inferior petrosal sinus. Done? Okay. Next we are going to start with the external jugular vein. Okay. Very simple. External jugular vein, it is formed by the union of posterior auricular vein plus posterior division of the retromandibular vein. Posterior division of retromandibular vein. Just let me show you the diagram. Yeah, here is the external jugular vein. Can you see? So external jugular vein is formed by the posterior division of the retromandibular vein plus posterior auricular vein. Okay, posterior auricular, this is the posterior auricular vein, this is the posterior division of the retromandibular vein. Posterior division of the retromandibular vein and posterior auricular vein gives you external jugular vein. And just by heart this diagram. This is really very important. Okay, very important. If you know this diagram, then venous supply is on your tips, trust me. Okay, so external jugular vein is formed by posterior division of the retromandibular vein and posterior auricular vein gives you the external jugular vein, and ultimately it drains into the subclavian vein. So it is formed by the union of the posterior auricular vein with the posterior division of the retromandibular vein, and it ends by opening into the subclavian vein. Repeat. External jugular vein, how it is formed? Posterior division of the retromandibular vein and posterior auricular vein. This is the posterior auricular. See, this is the auricle, correct? The ears. This is the posterior auricular vein, and this is the retromandibular vein. So this is the anterior division that is going that side, and this is the posterior division. So posterior division of the retromandibular vein and the posterior auricular gives you the external jugular, which ultimately drains into the subclavian vein. Done? This is about the external jugular vein. Next you have something about the subclavian vein. Subclavian vein. Just know something about the subclavian vein. It is the continuation of the axillary vein. Okay, it is the continuation of the axillary vein. Okay, beginning at the level of the outer border of first rib. Okay, beginning at the level of the outer border of first rib here. Okay, and ends at the level of the medial border of the scalenus anterior. Scalenus anterior, hope you remember the muscle, correct? By joining internal jugular vein to form brachiocephalic vein that I told you earlier during the internal jugular vein. Brachiocephalic vein formation, correct? How brachiocephalic vein is formed? Let me show you again. How brachiocephalic vein is formed? Internal jugular vein plus subclavian vein gives you the brachiocephalic vein, and two brachiocephalic veins unite to form superior vena cava. Very good. Next you have, yes, something very important about the facial vein, retromandibular vein and the common facial vein. Okay, let's start with the facial vein. Can you see here? Just draw this diagram in your notebook and practice this diagram. Anatomy you can learn only by practicing the diagrams. Trust me. Otherwise you have to mark. Okay, external jugular vein, this, like this. So to avoid that cumbersome procedure, please practice diagrams. Just draw this monster. Okay, draw this monster. Okay, chalo. This is the facial vein, correct? See, the facial vein supratrochlear here and supraorbital. These two unite to form the facial vein. Supratrochlear and supraorbital. These two veins unite to form the facial vein. And then you have something about the retromandibular vein. This is the retromandibular vein. It is dividing into anterior and the posterior. How retromandibular vein is formed? Superficial temporal. See, this is the superficial temporal and this is the maxillary. So maxillary vein and the superficial temporal vein gives you the retromandibular vein. Relax. I know you guys are getting confused. Okay, listen. Just draw one C, ulta C. Okay? Just draw one C, ulta C. This side is supratrochlear and near the eyes it is supraorbital, just before the orbit. Correct? So this is supraorbital. Supraorbital and supratrochlear is giving you facial vein. Done? Okay. Just in front of the ear, draw one line, one straight line or something like that. One straight line. That straight line is upper, superficial temporal. And just give some one arrow this side. Okay, this is maxillary. So maxillary vein, this is maxillary vein, superficial temporal vein. This is giving you retromandibular vein. Correct? And obviously retromandibular vein is having anterior division and the posterior division. This is outside. So this is posterior division. And draw one more line behind the ears. Okay, behind this ear. So this is the posterior auricular. This is the posterior division of the retromandibular vein. So these two uniting to give you external jugular and it is ending in the subclavian vein. Done. 3 veins are done. Facial vein, retromandibular vein and the subclavian vein. Next you have something common facial vein. Can you see here common facial vein? So it is retromandibular vein plus facial vein is giving you common facial vein. From here retromandibular vein is coming and from here you are having facial vein. So these two are uniting to give you common facial vein and it drains into the internal jugular vein. Okay, just take 5 minutes and first revise all these veins and then go to the next one. Okay. Once more you want me to repeat? Okay, I will repeat once more. Common facial vein, nothing but the facial vein plus the retromandibular vein gives you the common facial vein. Retromandibular vein here, superficial, temporal and maxillary gives you the retromandibular vein. I know during exam, no, you all will make mistake. Please practice this diagram. Please practice this diagram. Otherwise it's waste. Okay, please practice this. And then you have something facial vein. You are having supratrochlear and the supraorbital. These two unite to form facial vein. Okay. Okay. Chalo. We will start with the cavernous sinus. First, just go through these and then we will start with the cavernous sinus. Okay. Basically, cavernous sinus, okay, it is a large venous sinus and it is situated in the middle cranial fossa, okay, on either side of the body of this sphenoid bone. Where it is situated? It is situated in the middle cranial fossa, okay. And yes, something about the floor you should know. The floor of the sinus, it is formed by the endosteal dura mater, okay, endosteal dura mater. The floor of the sinus is formed by endosteal dura mater. Floor of the sinus is, repeat. Floor of the sinus is formed by the endosteal dura mater. And the lateral wall, okay, the lateral wall, roof and the medial wall. These are basically formed by the meningeal dura mater. Endosteal is for the floor, okay, rest all meningeal dura mater, okay. And yes, anteriorly the sinus extends up to the medial end of the superior orbital fissure. If you can know that anteriorly, okay, it is still the superior orbital fissure and posteriorly up to the apex of the petrous temporal bone. Just that's all. Anteriorly to the superior orbital fissure, posteriorly to the petrous temporal bone. PP and AS, anteriorly superior orbital fissure, posteriorly to the apex of the petrous temporal bone. And yes, about the size is very important. Okay, it is 2 cm long and 1 cm wide, 2 into 1. Okay, 2 cm long and 1 cm wide. Relation you can do, that is up to you. If you are not saturated or if you think that okay, I can do relation, then you can do the relation. Nahi to structures in the lateral wall are important, okay, that we can do. Structures in the lateral wall of the sinus, we have oculomotor nerve here. Okay, 3, 4, 5 basically. Oculomotor nerve, trochlear nerve, ophthalmic nerve and maxillary nerve. Okay, oculomotor, trochlear, ophthalmic and maxillary nerve. And then you have trigeminal ganglion also. Wait. Yeah. Oculomotor nerve, trochlear nerve, maxillary nerve, ophthalmic nerve. Okay. 3, 4 and 5 cranial nerve. 3, 4 and 5 cranial nerves basically. Okay. And structures passing through the center. You have here. This is important. Internal carotid artery and abducent nerve here in the center. This is really very important. Structures in the lateral wall of the sinus, okay, and structure in the middle part, that is the internal carotid artery and the abducent nerve. And yeah, here see structures, lateral wall, oculomotor nerve, trochlear nerve, ophthalmic, maxillary nerve. Repeat, okay, sorry. Yeah, and then you have here in the center you have internal carotid artery with the venous and the sympathetic plexus around it, okay, and you have abducent nerve. Abducent nerve is passing through the center, okay, and yeah, done. So this is important draining channels, very important draining channels. Let me start with this. First, if you are having BD Chorisia, you can open your BD Chorisia. There is a very good diagram in that book. You can use that. Or if you can see from here, you can see. And if possible, draw it in your notebook. Okay. Basically, communication means the sinuses. So, into the transverse sinus, it goes through superior petrosal sinus. These 5 points very important. Every time 1 or 2 questions pakka se they give. Okay, so just learn with me. Into the transverse sinus, into the transverse sinus, it goes through the superior petrosal sinus. Internal jugular vein, inferior petrosal sinus. Pterygoid plexus of the veins, emissary veins, facial veins, superior ophthalmic vein. This is very important. Okay, 4 or 5 times this question has come. Superior petrosal sinus, superior ophthalmic vein into the facial vein. And next you have into the facial vein through the superior ophthalmic vein, and the right and the left cavernous sinus communicate with each other through the anterior and the posterior intercavernous sinuses and through the basilar plexus of the veins. Okay, and basically all these communications are valveless and the blood can flow through them in the either direction. Don't worry, if you can learn this, well and good. Otherwise, in the GEMS Plus group, we will learn this together. Okay. So, and then we have something known as applied anatomy. We can do this. We can finish this. If you can give few more time to this, like into the transverse sinus through the superior petrosal sinus. Okay. Into the internal jugular vein through the inferior petrosal sinus, into the pterygoid plexus of the veins through the emissary veins, and into the facial vein through superior ophthalmic vein, and they communicate through each other right and left through the anterior and the posterior intercavernous sinuses. Okay, and yes, we have something about the applied anatomy for the internal jugular vein and this. What is this? Cavernous sinus. Okay, so applied infections from the middle ear basically spreads to internal jugular vein. Okay, first point. Surgical removal of the deep cervical nodes can puncture internal jugular vein. Surgical removal of deep cervical nodes. Okay, deep cervical nodes can puncture internal jugular vein. And yeah, thrombophlebitis can occur by spread of the infection into the cavernous sinus. Systolic thrill felt over the vein in the mitral stenosis. During CSF dilatation of the vein can occur. Okay, and yes, about jugular venous pulse. I hope most of you know about this, correct? Jugular venous pulse. It determines the activity of the atria and it is seen better than felt. Okay, basically. And elevation of jugular venous pressure indicates cardiac failure. Okay, indicates cardiac failure. Done. And about the cavernous sinus, The cavernous sinus thrombosis, it may be caused by the infection in the dangerous area of the face, nasal cavities and paranasal sinuses. It presents as nervous system nervous symptoms like severe pain in the distribution of the ophthalmic nerve, involvement of the third, fourth and the sixth cranial nerve. Okay, and these causes the paralysis of the extraocular muscles with diplopia. Okay, and communication between the cavernous sinus and ICA, internal carotid artery, after the trauma, it can cause pulsatile exophthalmos. Okay, pulsatile exophthalmos. And yes, intracranial venous sinuses, about this. Basically, okay, just know something about the intracranial venous sinuses and the confluence of the sinus, and then we will do the sinuses in detail if time permits. Okay, intracranial venous sinuses, basically venous spaces. These are the venous spaces between the ostial and the meningeal layers of the dura mater. Okay, these are formed by the reduplication of the meningeal layer. This is what I am telling about the intracranial venous sinuses. Okay, venous spaces between the ostial and the meningeal layers of the dura mater. These are formed by the reduplication of the meningeal layer, and it is lined by the endothelium, receives the blood from the brain, orbit, internal ear, CSF. And I told you these are valveless, bidirectional flow. Okay, it can flow in either direction. And something about the confluence of the sinus, it is not here. We will do it in GEMS Plus group. Confluence, just know what is confluence of the sinus. The point where the superior sagittal sinus, straight sinus and occipital sinus unite, that is known as confluence of the sinus. Okay, and it is located on the right side of the internal occipital protuberance. Located on the right side of the internal occipital protuberance. Okay, this is important. Communication training channels and applied anatomy. And okay, chalo, we will move to GEMS Plus group and we will discuss today about the various sinuses like straight sinus, then great vein of the Galen, or this great cerebral vein, or something like that. Something few important topics. Okay, chalo, bye bye.